Hello, I'm Karen Parry. I'm the director here at the East Brunswick Public Library, and I'm very excited to talk about a program that's happening at the library called Protect Your Bones, What Everyone Should Know About Osteoporosis. This program will be presented by Dr. Birju Bhatt. This will be a hybrid program happening at the library Thursday, November 20th from 1 to 2 p.m. So if you miss it, it will be taped. But I am so happy to be joined here by Dr. Bhatt today. Dr. Bhatt earned his medical degree from SUNY Upstate Medical University before completing his residency and internship at Rutgers, New Jersey Medical School, followed by a fellowship at Albany Medical Center. He is a proud member of the American College of Rheumatology and was chosen as a top doc by New Jersey Top Doctors in 2025. So welcome, Doctor.
Yeah, thank you. Thank you.
Doctor, can you tell us a little bit about your program and what you're going to be talking about?
So this talk is going to be about osteoporosis. Basically, it's a silent disease. The literal meaning of osteoporosis is weak bones or holes in your bones. And it's a disease that sometimes is overlooked because people don't feel it or see it. So what I will be talking about is what it is, what are the risk factors, what causes it, and what are treatments for the disease.
And Doctor, is this program for people that currently have osteoporosis, or who would be most interested and would benefit the most from the program?
Patients who are above the age of 50, particularly postmenopausal women, and men as well, who are of the elderly age. But I think it would be beneficial to those of any age, because obviously there's young people taking care of an elderly population, whether it be family members or loved ones that are in that age group.
So Doctor, tell us a little bit more about osteoporosis. You mentioned that it's a silent disease. Tell us a little bit about like some of the symptoms and some of the treatments and some of the highlights that you're going to be talking about in your program.
Sure. So in general, osteoporosis is, like I said, a silent disease. So it's nothing that you feel or you see. You know it when you develop a fracture, particularly a fracture that happens from a standing or a sitting position. Meaning that if someone slipped off a chair and you broke a hip, by definition, that would be defined as an osteoporotic fracture. Typically, people who do have osteoporosis, small bumps, movements can cause fractures, whether it be in the spine or the hip or even the wrist if they, sort of tripped over a rug or something like that. What's important about or to know about osteoporosis is that, in like 2019, they did a worldwide study and it showed that 8 million women and 6 million men above the age of 50 had a hip fracture. So the goal in terms of treating for osteoporosis is trying to prevent fractures or decreasing the risk of fractures from occurring. The concern always is that post-fracture, usually that the 1 year after the fracture, mortality rate is 24%. And so that is something that, with treatment, you're trying to decrease. And there's many medications, but most of these medications do the same thing. In a sense, they improve mineralization of the bones. And that's what is the goal of treating this disease.
That's very interesting, Doctor. And you mentioned that this program could be like for everyone. Could you just expand a little bit on how people of all ages can benefit from this program? Sure.
So typically, from a patient population standpoint, we tend to evaluate female patients above the age of 50 who are postmenopausal and men who are the age of 70 or above. That's when you evaluate patients with osteoporosis. And why it would be, obviously it's going to be beneficial for those patients in that age group, but for young, people who are taking care of their parents or loved ones who are in that range, sometimes, patients themselves might not be aware of being evaluated for osteoporosis. So, people of young age can obviously, if they're aware of this, then they can make sure that their loved ones or their parents or grandparents have been evaluated.
That's so interesting, Doctor. Well, thank you so much for doing this program for the library and for all of our residents. It will be extremely helpful to have the information for all of us so that everyone can have much better health outcomes and live their best life possible. So I want to remind all our viewers that Dr. Birju Bhatt will be speaking at the library on Thursday, November 20th from 1 to 2 p.m. in Meeting Room 3. It will also be taped, and it will also be a hybrid program. Check out our website, ebpl.org, to register for the November 20th program. And we hope that as many people as possible will tune in because it is such an important topic and it really touches everyone's lives. So thank you so much, Doctor, for joining us.
No, thank you for having me.